I think this is something we need to be very concerned about. There are two aspects to a second wave. The first is that we must anticipate a second wave in terms of excess deaths in the country from those people who haven't been able to get into hospital because of the hospitals being taken over by COVID-19 patients. And that may be already about to happen. And the second reason for a second wave is because it's too early for undoing the lockdown. If the pandemic was beginning today and we were just observing it at the current level of infections in the country, we would today go into lockdown. That would be the sensible way to operate. So I'm afraid we're being pushed too quickly to undo what the public has done so exceptionally well in bringing the infectivity rate down.
But the government and the scientific advisors are insisting that deaths are coming down and so are the number of infections, and that's why it's possible to move to a new level.
In Greece, before they had a single death, they started introducing their lockdown process. And in Greece, they're coming out of it with virtually no more deaths occurring, and the total number of deaths is 150. Now, there's no reason at all why Greece would be in a better position than us. If you remember, this all arrived in northern Italy before it ever came here, and the Greeks went straight into action. And if you look at that and see that they are now out of the pandemic, they are planning to really return to normal by the end of June, you just realize where we could have been if we had operated much more quickly.
You will have seen yesterday's press conference with the Prime Minister and the Chief Medical Officer and Scientific Advisor, and that moment where Boris Johnson stopped the BBC's question about Dominic Cummings being put to those officials. You have warned about the politicisation of these positions in the past. So was the Prime Minister right to do that?
Let me just, if I may, give you the example of the Prime Minister of the Netherlands, who last week his mother died in a care home. He was unable to go and see his mother and didn't break the rules and go and see her in the care home because in the Netherlands, the government had said, do not visit older people in the care homes because these are the elderly people who are most at risk.
So what would your answer to the question be as to whether Dominic Cummings sets a good example or not?
What he did in taking his wife, who he says he understood had COVID-19, to Durham, surely must be clear, is not what was advised in terms of stay at home. And I don't think that the question of legality is the real issue. The question is one of, was this sensible? And for somebody in a leadership position, does that give you moral authority to tell other people how to behave in the face of a pandemic? I do want to just add very quickly, this is a disastrous handling of the epidemic. There's probably been 40,000 excess deaths that could have been avoided if the government had acted responsibly and with moral authority.